orthopedic thing, a go-to destination for orthopedic insights and practical knowledge skills. I welcome you all once again to this channel. This is where I give you updates concerning the conservative management of fractures in the body and some other related conditions relating to orthopedic. And that is what I will continue to do. Last week, I talked about some of this method of holding fractures where I made mention of fractures that you don't manage and fractures that you manage, and what are the possible complications that can arise, because we have different ways bone formation can come through, and there are times that we don't seek for medical attention as far as bone management is concerned. So I made some illustration, I made some clearance there that for the fact that you don't seek medical attention to a broken bone or a fractured bone does not mean it will not heal. It's going to heal whether you seek a medical attention, whether you seek medical attention or not. But it's not going to heal based on the anatomical structure. What orthopedic technologist does is to bring back the normal anatomy and make sure the limb is functioning the way it was before. But when you don't seek medical attention, it can heal, but it's not going to heal based on the normal structure of the anatomy. So if you need more knowledge on that, get through the lecture, and I promise it's going to be okay. All right, my coming here today is just to take you guys through the journey of which I'm going to start next week. Next week, we are going to start 8 weeks journey, and I promise you this time it's going to be perfect. It's going to be lovely. Mainly, it's going to be for an educative session and more of practical session for orthopedic technicians, orthopedic technologists, and also for our parents, also for everybody. It's just for everybody in general. How things that you need to get concerning your bone management and concerning how healthy your bone should be, and what are the things you should take, and how often you should take care of your bones in your daily activities, and everything you need to know. So it's going to be lasting for 8 weeks from next week Thursday, which is going to be the 1st of May to 19th of June. So it's going to be a lovely one, and I have many topics I'm going to be discussing. Here with me, the first one I'm going to be talking about the bone formation. How are we going to talk about this thing? We can't be talking about bones without emphasizing on how those bones came to existence. So I'm going to be talking about bone formation. Likewise, I'm going to be talking about bone growth and development. How often they grow and the development of bone. What are the things that can make it to develop? And how do they develop? So I will be talking about that as well. Also, I'll be talking about the nutrition for strong bones. As an individual or as someone, if it is not necessary, you should be a medical personnel. You need to know what are the things that can make your bone to grow. Especially when we're having our age people, those who are getting older, there are things that we should be giving them. Or as an individual, there are things that you should be getting that will make your bone to be strong. So it's going to be part of what we're going to be discussing on. Also, we're going to be talking about the lifestyle habits for bone health. How often, what are the lifestyle that these things should bring as far as bone is concerned in the body. Also, I'll be talking about common bone-related issues and prevention. What are the issues that can come? Both children, pediatric, adults, geriatric, every other person. What are the common bone-related issues and how are we going to prevent them? So I will be talking about this as well. Also, I'll be talking about the strengthening bones through science, through exercise. Strengthening of bone through exercise. How exercise can help your bone to be strengthened, also to be more valued, to be more okay, and to be more perfect, to be more strengthened. So I'm going to be talking about this as well. What are the exercises that you need to be doing? What are the things you need to put in place? Either your bone is fractured or your bone is not fractured. So I'm not going to be majorly on fracture this time around. Bones generally in your body, how you should take care of them, and what are the things to expect, how you should give attention to them. Because when we talk about bones, we are talking about the bony frame of the body. Your whole body relies on bones, so you should take care of your bone very well. So I will also be talking about managing bones health. As you age, as you are getting older, how often do you need to manage your bones? What are the things that you should be putting there? What are the things that you should be using? Because as you grow older, the minerals in your bone will be coming down. So at that stage, at that point, you should be practicing some other things and should be putting some things in place. So how will you manage them? So expect that in my lecture as well. Also, I'm going to be talking about maintaining lifelong bone health. This is very, very important. So it's going to be the 8th lecture for the 8th week. That's going to be on the 19th of June. So stay tuned and make sure you don't miss any of this lecture, because it's going to be talking about your health. This time I'm not going to be talking about fracture. I'm going to be talking about bones generally. How you should take care of your bone. What are the things you should expect? How the bone came to existence and how to develop, how to manage them. And if you have aged people at home, how do you care for them? What are the things that they should be taking for the bone to be growing? We let you know that as your age is growing, your minerals, the bone minerals will be coming down. So at that point, you should be doing some things. So these are the things that you're going to be expecting. I promise you, and I tell you, these are full packed lectures, and I'm going to be revealing them from next week, which is going to be on the 1st. On my YouTube channel, which is going to be Dr. Paramount Auto, and on my Facebook, I will be live on Facebook as well, which is Abdullah Miro. So you can search that one on Facebook. I will be live on Facebook. So this will be done based on every week. Each lecture for each week, which is going to last for 8 weeks. So guys, I won't want you to miss it. If you are a technician or if you are a technologist, a certified one to be precise, and if you are a student, on everybody. So generally, this is an educative lecture which is going to educate us on how to treat ourselves, how to manage our bones, and how to give ourselves a long life bone structure. So with all this, I'm going to see you in the next class. So don't go without subscribing, because it is only on this channel you can get an adequate treatment based on the conservative management of fractures. And that is what I will continue to do. So in all that and more, I will see you in the next class on the 1st of May. Don't forget, 7 p.m.